Good morning. Thank you for joining us for an inspiring conversation about autism across the lifespan. My name is Dr. Nichole Scheerer, and I'm a professor here at Laurier, as well as a Laurier alumna. I'm sorry to share that our moderator, Laura Bailey, had to drop out at the last minute, so my fellow presenters and I will be pulling double duty as hosts. As we begin, I'd like to take a moment to acknowledge that Wilfrid Laurier University's campuses are located on the traditional territory of the Anishinaabe, the Haudenosaunee, and Neutral peoples. In alignment with Laurier's strategic plan, the Inspiring Conversation series seeks to elevate a range of perspectives and ideas, including those of our Indigenous colleagues. The sharing of knowledge is powerful and a foundational step towards reconciliation. We're grateful to share this space where we can hear, speak to, and learn from one another. Perhaps you're joining us from another location, and in that case, I would encourage you to take a moment to honor the Indigenous peoples who have lived and work where you reside historically and presently. Acknowledging them reminds us of our important connection to the land where we live, learn, and work. We recognize, honor, and respect these nations as the traditional stewards of our land and water. This morning, my colleagues and I will share some highlights from our research with you, and we'll open up our conversation to the audience and invite you to submit questions of your own. Please feel free to pop your questions into the question and answer box as we present. To start off, I'd like to welcome Laurier professors Dr. Janet McLaughlin and Dr. Margaret Schneider. So you guys can take it away.
Thank you. Thanks, Nikki. I'm Janet McLaughlin, and I'll be presenting some findings that of research I've conducted alongside my colleague, Margie Schneider. We're both Laurier professors, and together we are co-directors of the Laurier Autism Research Consortium. So our brief presentation today will discuss issues regarding disparities and barriers to accessing autism diagnostic and other services, as well as the impact of service barriers on families. Our presentation will focus on families with autistic children, and Nikki will then discuss issues facing autistic adults. So to begin at the very basics, autism is a neurodevelopmental condition characterized by differences in social communication and social interaction, and the presence of restricted, repetitive behaviors. Autism is called a spectrum for a reason, as autistic people can have a huge range of outcomes, from profound disabilities affecting all domains of life to unique and remarkable gifts allowing for meaningful careers. Diagnosis is important for many reasons, but one of the main benefits that early diagnosis provides is allowing faster access to funding for therapies and supports, which can make profound and life-changing differences in autistic children's long-term outcomes. Rates of autism diagnosis have increased drastically over the past decades, with 2018 figures showing that 1 in 66 children were diagnosed in Canada. But the most recent data coming out of the United States, right here, 2023, showing that 1 in 36 children is now diagnosed. While the average age of autism diagnosis is about 5 years in Ontario, the average age elsewhere in Canada is lower at less than 4 years. So before we get into our research findings, I wanted to briefly discuss my own journey seeking an autism diagnosis for my son, Sebastian. So my husband, who is a family doctor, first suspected that Sebastian had signs of autism at around 11 months old. He was a quiet child who enjoyed lining up objects, building towers, and playing with water, but he didn't respond to his name, make gestures, or speak any words. When we took our observations to our family doctor, he didn't share our concerns, saying that Sebastian was too young to be assessed. However, given that my husband was also a family doctor, as a courtesy, he referred us on to a pediatrician. The pediatrician shared our concerns, but indicated that he was unable to provide a diagnosis at that age either. So all of this occurred despite the fact that Sebastian's signs of autism were incredibly clear and consistent, and the knowledge among all of us how important early identification and therapy can be for long-term outcomes. We also knew that we required a diagnosis in order to get on the waiting list for the Ontario Autism Program, which is the main program that funds therapies and supports for autistic children in Ontario. So we found a private psychologist who worked in Toronto, and we drove Sebastian there for his assessment, which took about half a day and cost around $3,000. At the end of the appointment, the psychologist told us what we already knew. Sebastian received his autism diagnosis, and at that point, nearly a year had gone by, between when we first thought that there may be something going on and this diagnosis. But with this paper, the diagnostic paper, we were finally able to register for the Ontario Autism Program list, which we were then told was a long waiting list. So we waited for about 3 additional years before ever receiving publicly funded support. During this time, we paid for as much therapy ourselves as we could afford. And Sebastian made some really important gains. For example, since he couldn't talk, Sebastian's therapy team taught him forms of picture-based communication, which allowed him to finally tell us what he wanted. In his case, he requested pot lids, which he loved to watch spin on the floor, and I can't describe the joy and relief we all felt when he could finally start to express himself. Every person deserves the right to communicate, and no one should have to wait years to attain the supports they need to do so. This whole time, I kept thinking about the enormous privileges we had to get the early diagnosis and to be able to afford at least some therapy out of our pockets. We had every possible advantage, and still we struggled. So I could only imagine how situations for other families would be across the province. Those who don't have a physician as a parent or even access to a regular primary care provider. Those who couldn't afford a private diagnosis or private therapy, or who might not know to look at the signs for a developmental delay. Consider a sole parent with multiple kids who have no time to balance access demands, or recent immigrants who might not speak English or French and might just be learning about the healthcare system, or a remote First Nation family living on a reserve with no regular access to autism specialists. Think of a child with less obvious or consistent signs of autism, including girls who are less likely to appear with typical presentations. It doesn't take much of a stretch of the imagination to realize how compounded challenges can lead to later diagnoses and further delays in accessing therapies for the vast majority of children across Ontario in a range of circumstances. It should come as no surprise then that many children do not get an early diagnosis, even when their parents do notice concerns. That's why that average age is closer to 5, even when we were able to get ours before the age of 2. So even when families do receive a diagnosis, they then sit on other long waiting lists for much needed therapies, lists which are only growing longer each year. I mentioned we waited 3 years. Families now are waiting 5 or 6 years, and the newly diagnosed are being told they actually don't know how long their wait will be. This has prompted frustration, heartbreak, and massive protests throughout the province, with a list of now about 60,000 children waiting for access to autism therapies. So this context inspired my interest in autism service and equity research, and I was very fortunate to connect with my colleague Margie, who also has a long-standing interest in autism caregiver experiences. Together, we co-founded the Laurier Autism Research Consortium, or LARC, in 2019, and we have now led 2 major surveys with Ontario caregivers, one published in 2019 and the other just last year. We also started conducting focus interviews with newcomer and Indigenous families who were underrepresented in our surveys to better understand their experiences. And this is also the focus of our current ongoing research. So I now invite Margie to share some of these research highlights with you. Margie?
Thanks, Janet, for this introduction. I will now highlight some of our findings in relation to obtaining an autism diagnosis from these 3 different studies. As Janet mentioned, this topic was not the main focus of either a survey or the interview study, but it was an aspect of this autism journey that was reported on frequently by parents, highlighting its importance overall in this experience of autism in the family. More namely, our research highlighted disparities in access, particularly in terms of geography and race. As previously mentioned, these studies were conducted with Ontario residents, and this geographic disparity was most notable in terms of a lack of services in Northern Ontario when compared to Southern Ontario. One such participant from our survey in 2022 stated, "I live in a rural community up north, and all that is offered is virtual therapies that don't work for my son. Most of the other therapies we are waitlisted forever, and professionals need to travel a long distance to get to us. It is overwhelming." Another disparity we uncovered in our research in terms of access had to do with race. According to DiPietro and colleagues, Indigenous parents report a lack of parental supports and resources in addition to a lengthy and complex diagnostic process. One of the Indigenous parents from our interview study reaffirmed this notion by stating, Other than me ticking off the box saying that we're Indigenous, it really doesn't matter because we don't get the resources that we need because the wait lists are so long. There have also been noted disparities with respect to gender and autism in the literature, but this was not a topic we explored in our own research, and I do believe this is a topic that will be discussed shortly by Nikki. With respect to barriers, parents described many in terms of the diagnostic process. Particularly, parents in our 2019 survey described a cascade of wait lists, first for diagnoses, then for other services. In fact, they reported waiting an average of 2 years between suspicion of signs and attaining a formal diagnosis. Additionally, 33% of parents in the same survey reported that it took a long time to even get an appointment with someone who could offer a diagnosis, further delaying the process. This was confirmed by a parent in our 2022 survey who stated, "We were on a wait list for 3 years, the most formative years where something should have been done. We knew he needed help, but didn't know what kind of help he needed from the age of 12 months. He was 2 years and 4 months before we got a diagnosis." Our interviews with Indigenous and newcomer parents revealed language and culture as being significant barriers to services, both diagnostic and therapy related. One newcomer parent reported, "Sometimes I feel that because we have different accents, service providers will not answer all the questions or just end the conversation quickly. It doesn't happen with everybody, but there are people who do that. Or because of our skin colors, some people will have this perception of you, and they will try to hang up the call, which was supposed to be 30 minutes, but it will end in 10 minutes. So they're not spending the time to explain things. They will just say, okay, any questions? And then bye." Out-of-pocket costs for diagnostic services were also commonly reported, with approximately 1/4 of the families from our 2019 survey stating that they paid out-of-pocket to receive a formal diagnosis of autism for their child. The reported amount paid by these families on average was approximately $2,500, and this paid for the services of a private psychologist, particularly to obtain an early diagnosis for their child. This therefore creates a two-tiered system between the haves and the have-nots within our society, highlighting a significant equity imbalance with respect to early diagnosis and diagnostic services in general. One parent from our 2022 survey remarked, "Our son's diagnosis has brought on additional financial stress. We had to do private assessments at significant costs due to Ontario's horrible waitlist for funded assessments, and the cost of his recommended therapies are astronomical due to no funding for therapy. I feel failed by our Ontario healthcare system. I also will have to transition to part-time to manage my son's therapy schedule, causing more financial strain. I'm so disappointed by the lack of support for ASD individuals and their families." So what are the implications of these disparities and barriers to access when considering diagnostic services with respect to autism? This most notably translates into delayed supports as described by one of our Indigenous caregivers. "I know that there was only so much time for funding to get the services that he needed in place. And because I have fought with everybody to get this diagnosis, it has prolonged the services that he so desperately needs. It should never be this hard. A parent or guardian should not have to fight after presenting all the evidence and having all the signs of autism be ignored." Additionally, these disparities result in a reported reduction in quality of life for families. One parent from our 2022 survey stated, "I don't think that I have had a good night's sleep since 2010, when I first learned of my child's ASD diagnosis and entered the realm of parents with special needs children who, as physically strong as we all are, endure physical punishment from the stress loads placed upon us as a result of spending our time advocating for our children 24/7. Lastly, these disparities and barriers also result in significant financial burden due to the exorbitant out-of-pocket costs for diagnostic services and therapies and/or parents having to leave their jobs to support their child and get them to these much-needed services. One parent from our 2019 survey reported, "Prior to being a parent, I was able to work full-time and had full benefits and was able to invest in my retirement. Now I have constant worry about money and care of my disabled son. There are no service providers for before or after school care for 13-year-old children with a significant financial impact. Without a significant financial impact. I love my son. However, the financial impact has led to a second-class life in our current society." It is evident from our findings that families are struggling. In particular, our key findings across both provincial surveys and an interview study with Indigenous and newcomer caregivers revealed the following. There are extremely long wait lists for diagnosis, which lead to even longer wait lists for services. Critical developmental years are compromised and or lost while waiting on these wait lists. Those who can afford to pay may jump the queue, although enduring significant financial hardship in the process, and those who cannot afford to pay wait much longer. And we also found that there were further disparities in compounded barriers for underserved populations, such as Indigenous and newcomer families, and we intend to learn more about their unique experiences in our current study. So after all this, what do we recommend? Well, we have many recommendations resulting from our research, but to name just two in relation to the diagnostic process, we recommend that the cost for receiving an autism diagnosis, whether attained through a diagnostic hub, pediatrician, or a qualified private psychologist, should be covered by the government. And the government must prioritize reducing wait times for both diagnostic assessments and therapies to ensure that children receive services and supports in a timely manner and when the most significant outcomes can be made. They should also pay particular attention to ensuring the unique and compounded access barriers faced by underserved communities and make sure that these are addressed to promote equitable outcomes. So just to finish off then, we'd like to thank our contributors and our funders for the projects described herein. We've worked extensively with Autism Ontario. Dr. Vanessa Fong was a LARC research associate that helped us and co-authored this presentation. And our funding sources were from SHRC, Autism Ontario, and we also received a gift to LARC from the Dare family in honor of the late Carl M. Dare. We've also included a handy QR code here that will take you directly to our website and where you can find all things LARC. And more specifically, you will find both of our reports and other publications, as well as more information about our research team. So thank you for listening, and we'll now pass it over to our colleague, Nikki, who will discuss the situation facing adults.
Thank you, Janet and Margie. That was very informative. I will just transition over to my slides. So hello again, and thank you for having me here today to speak with you. As I mentioned in the opening, I am a Laurier alumna, having completed both my undergraduate and doctoral studies here at Laurier. After I completed these studies, I left Laurier for postdoctoral fellowships at Simon Fraser University in British Columbia, as well as Western University here in Ontario. And 2 years ago, I returned to Laurier, where I was hired as an assistant professor in the psychology department. I am a cognitive neuroscientist by nature, and much of my work focuses on how differences in sensory processing may have downstream effects on other functions, such as speech, social abilities, and language development. That being said, in the process of conducting a lot of my experimental work, I spent years working closely with the autism community. As a result, I've become very aware of the difficulties this community faces, and I've become very passionate about using my research know-how to help promote change. Relevant to today's talk, I've recently been working to better understand pathways autistic children and adults follow as they attempt to obtain an autism diagnosis. So today my talk is going to focus on undiagnosed autism in adulthood, including a discussion of why autism goes undiagnosed in adults, as well as why an autism diagnosis is important, even for adults. So I want to start my talk today by highlighting the fact that autism is a lifelong neurodevelopmental disorder. What this means is that differences in how the brain develops results in differences in various brain functions, which can include things such as differences in language, social skills, emotional processing, self-control, and sensory processing, amongst other behaviors. What's less obvious when we use the term neurodevelopmental disorder is the fact that differences in brain development have effects that tend to last for a person's lifetime. Given autism persists throughout the lifespan, if autism is not diagnosed early in development, we end up with autistic adults who are undiagnosed. The first descriptions of autism surfaced in the early 1940s by child psychiatrist Leo Kanner and pediatrician Hans Asperger. Over the past 80 years, our understanding of autism has evolved substantially, alongside exponential growth in research. As depicted on this figure here, we can see that the number of research reports on autism published between 1940 and 2020 has increased dramatically. With this increase in research has come changes and refinements to the autism diagnostic criteria, as well as increased awareness about autism more generally. As a result of this, we find ourselves with what some refer to as the lost generation, adults whose autism has remained undetected or undiagnosed until adulthood. So this leaves us with the burning question, why does autism go undiagnosed? Well, obviously my other speakers spoke to that a little bit in their talk, but there's many other reasons as well. So thinking about missed autism diagnoses, the first important thing to consider is a defining characteristic of autism is the fact that it's a spectrum disorder. What this means is that although autistic people share the same core characteristics, there's huge variability in how autism presents in different individuals. As a result, some presentations may be less obvious, particularly if they don't fit the stereotypical representation of autism. The way I usually like to describe this is there's a whole host of different traits and characteristics that are associated with autism, such as differences in language, social skills, executive functioning, sensory processing differences, and focused interests and behaviors. If you consider each of these individual traits or characteristics as sort of a dial or a slider, each autistic person has their dials or levers set to different levels. When you combine these dials, these different combinations of traits create the variability we see in autism. So in the example we have here, Jane has relatively average language skills, below average social skills, and heightened sensory processing abilities, while John has relatively weaker language, stronger social skills, but difficulties with sensory processing. In this example here, I'm only describing 3 traits associated with autism, but if we extend this example to include other associated traits like differences in executive functioning, focused interests and behavior, sleep patterns, anxiety, depression, you can start to see how this can lead to autistic people who have very different strengths and challenges and thus appear very different. So while variability in autistic traits creates diagnostic difficulties, this is also exacerbated by the fact that autistic people often camouflage their autistic traits. What I mean by this is autistic people often use learned coping strategies to mask or hide their autistic traits. Since autistic people may not intuitively know how to act in social situations, they may mimic or copy the behaviors of non-autistic people in an attempt to try to fit in. For example, autistic individuals may force themselves to make eye contact or show displays of emotion while they interact with other people, despite the fact that they feel uncomfortable making eye contact and they feel like their emotions are inauthentic. So while these camouflaging behaviors can help autistic people navigate social environments, they can even allow autistic people to make friends and form romantic attachments, they do come with harmful side effects. Camouflaging has been found to negatively influence autistic people's self-identity and mental health, as well as promote internalized stigma or sort of shame around being autistic. Relevant to our discussion today, when autistic people successfully camouflage, their autistic traits are less apparent, which may lead their autism to go undetected and undiagnosed. Another factor contributing to undiagnosed autism is the fact that autism often co-occurs with other neurodevelopmental, mental health, and physical health conditions. For example, a recent study looking at approximately 30,000 autistic children and adults found that co-occurring ADHD was found in approximately 50% of the sample, while anxiety, developmental delay, mood disorders, and seizure disorders were found in 16, 15, 17, and 8% of the sample, respectively. When conditions co-occur, this can make diagnosis more difficult, and in many cases, autism can be overlooked in favor of one of these other, often better understood conditions. Just recently, I was part of a discussion panel with an autistic female who was diagnosed at the age of 20. This was only after receiving an ADHD, an obsessive compulsive disorder, and a generalized anxiety disorder. She spoke of the frustration knowing that something was different, but clinicians and psychologists couldn't put their finger quite on what it was. And with each new diagnosis, she didn't come any closer to understanding who she was or what was different about her. Another important consideration is autism can present differently in females. While current estimates suggest that autism is around 3 times more prevalent in males, some researchers have expressed skepticism about this statistic, given gender biases that are apparent in the diagnostic criteria for autism. Recently, researchers have described what they call the female autism phenotype, highlighting the fact that autism appears differently in females. Notably, compared with males, autistic females are less likely to show overt restricted interests, which are a core diagnostic criteria of autism, and this can cause autism to be overlooked. Further, females are more likely to camouflage their autistic traits, which may increase their social success, and again, in the process, hide another major diagnostic criteria, social difficulties, again, making diagnosis more challenging. Lastly, many key professionals such as teachers, family doctors, and psychiatrists still hold stereotypes that autism is a male disorder. This may decrease their sensitivity to these autistic symptoms in girls. Further, these factors contribute to more diagnoses in females when they're combined. The last major point I want to touch on is that the autism diagnostic system is broken. Again, we heard a little bit about that in the last talk, but this is particularly relevant to adults seeking a diagnosis. Given autism is a neurodevelopmental disorder, diagnosis in adulthood is inherently difficult. A diagnosis relies on knowledge of developmental history, access to early medical records, and accurate recall of developmental milestones. The inability to access this information can be a big obstacle. Secondly, as we've spoken about already, many autistic people adopt camouflaging strategies to mask their autistic traits. By the time an autistic adult is assessed, they've developed and practiced these strategies over many years, making assessment much more difficult. Aside from these challenges, in Canada, autistic adults have to deal with a limited number of professionals that are trained and or willing to assess autism in adulthood, which leads to long wait times and delayed access to care. While reliable data on autistic adults' experiences with diagnosis here in Canada is lacking, what we know from reports in the UK and Australia is that on average, about a quarter of autistic adults diagnosed in adulthood receive their diagnosis upon initial consultation with their doctor. That means that 3/4 of the sample had to see many specialists before they received this diagnosis. The stats indicate that over half of the adults received at least 3 referrals before being diagnosed, while over 20% of the sample had to be referred more than 6 times before they received their diagnosis. On average, these adults reported that it took them more than 2 years to receive their diagnosis, and most concerning, more than 40% were dissatisfied with the diagnostic process. While these numbers certainly paint the picture of a broken system, we're currently lacking data on adults' experiences here in Canada. Working with autistic adults, I've heard firsthand the struggles they've gone through trying to obtain a diagnosis, which has led my colleagues and I to develop a project investigating pathways to an autism diagnosis here in Canada. With this study, we're collecting information about adults' experiences, including things like delay times, number of referrals, and overall satisfaction with the system. As an aside, we are collecting similar information from parents to also try to better understand their experiences as they attempt to obtain a diagnosis for their child. With this data, I hope we can better describe the state of the system here in Canada and use this information to advocate for change to better support autistic adults and families of autistic children. So to finish off, I'm going to talk about why this is important. So given many autistic adults spend a large portion of their life undiagnosed, you may be wondering why we care. Well, obtaining a diagnosis in adulthood can be beneficial in many different ways. Many adults seek a diagnosis to gain a better understanding of themselves. Recognizing and accepting their autistic identity can provide clarity and explain past experiences and challenges. A formal diagnosis can also open doors to support services and accommodations that can improve an individual's quality of life. This may include things like therapy, social skills training, or workplace adjustments. An autism diagnosis can also provide a sense of belonging to the autistic community, which offers a supportive network of people who share similar experiences and challenges. Some adults seek a diagnosis to validate their experiences and feelings. It can affirm that their struggles and differences are real and not just the result of personal failings. In some cases, having a formal diagnosis can be necessary to access legal protection and educational accommodations, especially in the workplace or at educational institutions. And understanding one's neurodiversity through a diagnosis can lead to improved mental health and well-being while reducing feelings of anxiety, depression, and alienation. These are just some of the reasons diagnosis is important and why we're committed to trying to improve the diagnostic system here in Canada. Again, for adults and for children, but it seems like we're facing two separate problems in a sense. So I think it's important to focus on both of these problems with a slightly different lens. So thank you for listening. We're now going to move on to a question and answer period. But if you'd like to know more about anything that I've talked about today, or you just want to have a conversation after this, please feel free to reach out to me or visit my website.
Okay, thank you so much, Nikki. That was really, really interesting and informative. And as much as I've learned through parenting a child, I have so much to learn about adults. So it was really, really helpful for me. I'm seeing the questions come in, and we don't have a moderator, so we're just going to take them one after the other ourselves. What I'm noticing with the trend with the questions is a lot of them are not relating to diagnosis. They're relating to many other issues that people are interested about, which is great to see. We may or may not have expertise in some of these areas, but we can at least read out the questions. And if anyone feels like they have any insights, they can jump in. So the very first question I see here is, what type of schooling, online, in-person, communication-based, one-on-one, etc., would you recommend for education options for teenagers or young adults with autism? So this is definitely not my area of expertise, but I guess what I would start off by saying is, probably not very helpful, is that it completely depends on the individual and their unique needs. Some I've seen thrive in online environments where they're less pressure based on social interactions, whereas others really benefit from a social group to interact with at school, and others, like my son, absolutely require one-on-one support to be able to focus and learn. Does anyone else have anything they want to add on that question?
The one thing, Janet, that I wanted to add is, well, it wasn't a focus of this presentation. Education was a major focus of both of our surveys. So we have extensive information on what kinds of issues families were encountering in schools, like things like school exclusions. We did our one study, as you know, was before COVID, and then we had the one post-COVID. So we've got some great comparison data in terms of how things may have changed. And really, we just found that things got worse. So the problems compounded, nothing seemed to improve. And we also found in that research that a majority of children were poorly engaged with online learning. So as Janet says, there's lots of variability, but in terms, if we were just to look at the general spectrum, people did not find that the online learning was very effective for their children, and that the appropriate accommodations weren't necessarily able to be made. So I would encourage anyone who is interested in more of the education piece to take a look at both of our documents, because we did address it quite extensively, and it'd be a great idea for another talk at some point, because we do have a lot of interesting findings in that regard.
Okay. The next question I see here is there work towards ensuring non-ABA centered therapies become covered for autism support? Yes, that work has been done. There have been calls for that over many years. And the most recent iteration of the Ontario Autism Program since 2019 does include a range of therapeutic options, including occupational therapy, speech language pathology, and mental health, in addition to ABA. Even technology is covered with recommendations. So yes, it has moved beyond an ABA only program. Okay, and then the next question I see was about the education system. I think you just covered that one, Margie, that there are a lot of problems related to the publicly funded education system, to put it mildly. As Margie mentioned, we did do 2 reports that cover education in a more comprehensive manner. So if you're interested in those issues, on our LARC website, both of those reports are available for download. And just needless to say, the education system is completely underfunded for all sorts of children with exceptionalities. And it relates to huge problems with lack of, inclusion and full education, as Margie said, both before COVID, after COVID, and during COVID. Shall I just keep reading the questions and see who wants to chime in? The next question I see here was around issues of financial assistance for post-secondary. My family's experience is that there is no understanding that students have higher costs from a variety of sources, and any bursaries directed at students with disabilities just reduce dollar for dollar other forms of support. Then there's the issue of the reduced workforce participation parents did during elementary and secondary schooling in order to help prepare and launch the child into post-secondary. Yep, that's a huge concern. So you had less money to save in RESPs or any other way. Then if you increase your income now that your child is more independent, OSAP now says it all goes into the student fees. It feels like being punished every way you go. And that's before getting another round of diagnosis, $3,000 to apply for status as a disabled adult with CRA and other government institutions, and as a disabled student to get accommodations and supports, just when $3,000 could go to tuition and other costs. This isn't so much a question I think we can answer as a really important commentary that I felt it was important to read out, given all of these are really real issues. I don't think any of us have focused on these issues yet with adults, but that is an area that at least Margie and I would like to get into in our next research program. And I'm not sure if Nikki has done anything in the area, but thank you for raising these really important concerns and how they compound over the cycle of a child's life as they mature into an adult. And it does feel like families are kind of getting punished over and over again, not looking at the sacrifices they may have made. That's another area we're focusing on, is the amount of just sheer money that families forego because they have to quit or downgrade their jobs to make up for the lack of education and therapy supports. So it is a real compounded challenge for families, and governments need to look into how to provide more holistic supports across the lifespan for sure. Anyone else have anything to add on that one?
No, I think that covers it pretty well.
Okay.
I think Nikki there was some questions in here that you were hoping to address. Did you want to?
Yeah, sure. I can take over for a second. I'm sort of just kind of trying to scroll through and see what questions I can provide meaningful answers to. So one of the questions was, do studies also measure the prohibitive nature of the cost of assessment for adults? And certainly that's something that we're hoping to address with the survey that I spoke about earlier in my talk. So we are looking into sort of, I guess one of the main focuses of this study is trying to understand systemic biases in this system, which, as Janet and Margie pointed out, there are many of them. And one of them is very much linked to costs. And people who have the benefit of paying for a private assessment are often able to obtain a diagnosis, when those who don't have that luxury are often the ones that are waiting or never get an answer. So even speaking with a local clinical psychologist before we presented today, that's one of the things that she highlighted. She said, I know one of the big barriers right now is cost, and in brackets she wrote, I'm sorry, but that's just the nature of the game right now. And that's something that we're trying to highlight with the research, so we can say this is a big problem. cost shouldn't be a barrier to healthcare. So again, hopefully that sort of answers that question. Another one that was sort of related to that is someone said, curious what your thoughts or stance is on self-diagnosis of ASD. That's something that I see coming up a lot more, especially when we have adult participants reach out to us to participate in our studies. I think that it all depends on what your motivation is for seeking a diagnosis. So on the last slide of my presentation, I talked about a lot of the reasons why diagnosis can be important, and that can be very different across different individuals. If the reason you're seeking out the diagnosis is to get access to certain services, if it's because you're looking for workplace accommodations, if it's because you're looking for educational accommodations, unfortunately, in cases like that, it often is required that you have a formal diagnosis and a written report, and that's what will allow you to legally battle or fight to have those accesses to services. But if you're simply looking to get diagnosed to try to better understand yourself, to find a community to fit in with, those sorts of reasons, then I definitely think that self-diagnosis can be a very valuable tool. I don't know if Margaret or Janet has anything to comment on that topic.
No, I think that you covered it really well. I'm just reading through some of the other questions. One of the questions, it's another really good question, and I wish we had government policymakers here to hear it. I have some questions related to how mental health is addressed by policy in Canada and or Ontario. What is the rationale for mental health diagnosis and treatment not being covered by the public health system? Are some of these debates reaching policymakers in any way? Again, this isn't an area of focus for us, but just my general understanding is when the healthcare systems in Canada were first being formed based on this principle of medically necessary treatment being hospital care and care provided by a physician, that was really narrow as defining what will always be covered publicly. And since then, there have been numerous debates about, well, what other things should we include in healthcare? So some people, of course, argue dental care, optical care, mental health care, disability services should be covered under healthcare. And those debates are occurring at both provincial and federal levels all the time. But because of the high price tag associated with covering any of these fully under the public purse, they do remain contentious because that money has to come from taxes. People resist raising their tax dollars. I'm getting into my health policy lens now. But if these are important issues to you, and I imagine they are, the best place to go with that is to your elected representatives and say, I would like to see these publicly covered. I fully support that. It is a health issue. It should be covered. No one should have to wait an extra year or two, as I said, because they don't have private insurance or they can't pay out of pocket for something as fundamental as a diagnosis for this type of issue. And then another question I see, anyone wanting to add on to that one? Are there any currently new ways to diagnose children coming from recent immigrant families in Canada? That's what we're currently doing some research on. And so look back in a year or so from now, we'll have some way more information on that, I hope. But one organization you could look at is called SAAC, SAAC, or the South Asian Autism Awareness Center. They've done some really interesting and innovative diagnostic outreach projects with various populations, and they have a great website with resources and other tips. Anyone else see a question that they want to jump in on?
I've sort of been typing answers to some of them in the chat, but I was just about to write back to this one question. So how should you best prepare for an autism assessment as an autistic adult? So again, this was something I did a little bit of background research on before the talk, and a couple different things were brought up. First of all, I think your best bet in terms of getting a private assessment as an adult is to find a psychologist that works with both children and adults. If they work exclusively with adults, they might not understand the key developmental milestones that are important for an autism diagnosis. There's a chance you can start the process by just going to your family doctor, but there's still many family doctors that aren't comfortable and don't know, aren't that knowledgeable about autism. So again, your best bet is probably to reach out to a psychologist who has experience in the domain. When it comes to actually preparing for it, you do want to make sure that you tell the psychologist that you're seeking a diagnosis, because the standard psychological assessment often isn't specific enough to pick up on autistic traits. So having that, or the psychologist having that knowledge, will prepare them to do an appropriate assessment. And then I think just having a good grasp on your developmental history. So having things like knowledge of when you learn to talk, when you learn to do various different things. One thing that was brought up in particular is having a record of your report cards. If your parents kept your report cards as a kid, sometimes the things that are mentioned and not mentioned in the comments on the report card can be very, very informative to the psychologist. So sort of collecting all of that information, and also being aware that the psychologist might want to reach out and speak with siblings or parents that observed you during that developmental period. All of those things can be very helpful to inform the picture. Again, Janet, Margaret, if you have anything to add.
Oh, that was great. I'm again reading through other questions to see which ones I could answer. I'll just quickly jump in on a couple others. How can we as parents improve the system? This is a great question. I think it's one that we parents ask ourselves all the time. And unfortunately, it has come down to parents literally getting involved as protesters and advocates to improve a broken system. So right now there are groups active, such as the Ontario Autism Coalition, that regularly hold protests and organize political rallies and other events to try to raise awareness. They meet with politicians, they try to have petitions, all sorts of things. So but just if you don't want to get involved with the group, you can simply contact your local representatives at both the provincial and federal levels. Let them know your experience, because they are the ones that control the purse strings and the policy making. And when parents get involved in this way, or likewise adult autistics get involved in this way, change can happen. So if they don't know that there's a mass level of frustration, they won't act on it. They need to hear from people. And very quickly, I'm seeing lots of questions just about what resources are out there to help children or to help adults. We can't spend the time listing off websites in our head right now, but a couple of good places to start. On Autism Ontario has some amazing lists of resources and webinars for both children and adults. And on our LARC website in the coming months, I'm hoping we're going to put a lot more resources up there. I currently have my students working on infographics specifically for this purpose, to try to provide really bite-sized pieces of information on where to find information on this topic or that topic. And I hope to add some of those to our website in the coming months. So those are a couple places to start, but you can also feel free to be in touch with any of us after the talk, and we can actually send you URLs that we can't list out on the talk right now. Any other questions people are reading?
There's an interesting one here about what does institutional living look like for an adult autistic person, and that's a big one. And as Janet mentioned, that's something we've only done our research with young children. But when we've done those surveys, we've had self-advocates and parents of adults contact us and say, why are you not asking about our needs? Like, these kids get older, and we're like, absolutely they do, but the needs are so different between children and adults, right? So we've focused in one area just so that we're not, so we're able to find out everything narrowly about that one age group, but we're very interested in looking into adult needs in terms of housing. And anecdotally, I can speak to the fact that living outside of a parent's home as an adult, for someone who's on the more severe end of the spectrum, finding a place and what that looks like is very difficult right now. Again, waitlist, and being able to find something that is a humanized type living environment that is not institutional in nature and is community-based and all of those types of things, that just amps up the difficulty as well. And I have in recent months, sadly, heard of different cases of parents that out of desperation are essentially abandoning their children because there is nowhere for them to go. And as horrific as that sounds, it reminds us of how desperate families are to get the supports they need. And we really don't have a good system for finding these housing needs for adults with autism. once they've aged out of all the other support systems. And it's devastating to hear those stories. And again, stories that need to be told that we definitely want to be able to give voice to as we move on with our research.
Another question I see here. I have a 14-year-old with autism and ADHD, a neurotypical child who is 7, and 4-year-old girl who may or may not have autism. If no concerns have been raised by teachers or caregivers, but I have noticed indicators of autism in my 4-year-old, should I invest in an out-of-pocket assessment? Yes. Maybe not out of pocket, but you should add, I mean, I can't give medical advice, but just based on my own personal experience with children with various needs, is parents often notice these things in different ways than teachers or healthcare providers. As Nikki mentioned, sometimes kids can mask or camouflage their behaviors in one environment and not another. I highly, strongly always recommend, be an advocate for your child, push to get that assessment. A trained professional can see things that maybe others might not. So, you can get put on a wait list and get a full assessment, or you can pay out of pocket and get one faster, as others have done. But whatever route you take, I always recommend, if you have concerns, raise them and advocate to have them fully addressed. There are so many questions here. It's just, the level of engagement is so heartening. And I'm worried we're not going to get to all of them, but thank you so much for everyone for typing these in and for being so engaged. Do either of you see one you can answer?
Well, I was just going to say, as I'm sure is the case for both of you, we're very happy to answer questions after the session as well. So I know I put the LARC website in response to one of the questions, as well as my own website, and we'll make sure our own emails are available as well, because again, I'm very happy to engage in more conversation about this. I did see one question that I was sort of interested in answering, and it said, are you able to provide examples of the types of accommodations or changes in the workplace that may create more accessible environments for autistic adults? And I think on this topic, one thing that we often try to promote is the idea of universal design. So let's not focus specifically on making the environment better for autistic people, but for all types of people, and accommodating all different unique needs. So if you aren't familiar with the idea of universal design, I recommend just doing a little bit of Googling. There are a lot of resources available to help give you ideas as to how to make the environment more accessible. And I would say, if you're speaking more specifically because you know that you have an autistic person in your workplace and you want to be more supportive, a good place to start is just to ask them if their accessibility needs are being met, and if there's anything that you can do to try to accommodate. Often there's very simple changes, like changes in lighting or sound level. Again, I'm very biased by the fact that I'm a sensory researcher, and I know how challenging harsh sensory environments can be. But again, there's very simple things that can be implemented that can make a big difference. So that's sort of my blanket answer.
Nikki, I noticed another interesting one here that I wonder if you could comment on. It says, what pathways to diagnosis are available to a low-income senior woman who believes that she is on the spectrum? There is a strong family line of diagnoses in her children, siblings, nieces, and nephews, etc. So have you seen any work with seniors, or?
Again, I answered another question that was a bit similar to that one. It wasn't specifically geared towards seniors, but it was someone else who asked, they've gone to their GP and they won't provide a referral, and they don't have money to pay out of pocket. Unfortunately, right now, there aren't any good pathways. I think relating back to sort of the motivation for getting the diagnosis, if it's simply to better understand yourself, there's definitely some autism diagnostic surveys that you can take, and it can just give you a little bit of insight into how you score relative to other adults, those sorts of things. And based on doing some research and maybe filling out some questionnaires, you could somewhat reliably self-diagnose. But if you're looking to get the diagnosis because you need accommodations for work or for school or something like that, unfortunately, right now, there's not a lot of good solutions other than paying out of pocket, which is horrible. And I wish that I could report something different.
There's another interesting one here too. I'm wondering if you know of anyone doing research or writing on older adults with autism again and dementia. I have been trying to find any information to support my father, who has been recently diagnosed with dementia and who we are sure is undiagnosed as autism. This is going to become a major issue in the coming years. Having had a parent as well that suffered with dementia, and now when we have these co-occurring diagnoses of autism and dementia, and I'm not aware of any research out there on either of those, or either of you. Again, just not having been in the adult diagnostic field, that seems to be that's going to be a huge issue coming up as we have such a major cohort of people that are aging. And again, with the rates of autism, that will become a pressing issue, but I'm not aware of any research right now that's being done in that area.
No, I'm not either.
The questions are more giving me great ideas for the next projects,
Yeah,
but
exactly.
unfortunately not like stuff we already know and can unfortunately provide any insights on today, but we are reading them all and realizing how important so many of these issues are. It's overwhelming because we only have a couple minutes and there's so many comments and questions here. So yeah, I do hope we can be in touch with people after the fact and continue any conversations and help we can provide, realizing that our expertise is limited to just the areas in which we do our research, but sometimes we can connect you with others who might have different expertise.
Yeah, I think we can do maybe one more question and wrap up. I just saw one that I could answer relatively quickly.
Cool. Yeah.
So someone asked, what do you think about not wishing to use functional labels and preferring high or low support needs instead? Again, I think that's a great thing. I think focusing on the support needs of the individual rather than trying to characterize them as high or low functioning is a very good sort of movement that we're making in the field. I know when I try to talk about this with my students, I always bring up an example of someone I worked with when I was in British Columbia. She was a research assistant in the lab with me. She was also a huge self-advocate, and she worked with a lot of the local autism organizations, and she was a rock star. Like, she was going out and doing these huge presentations to huge audiences. From so many people's perspective, she was functioning so well and doing so much. But from her perspective, she considered herself to be a very low functioning autistic person because of everything that she was coping with in her everyday life and the extensive periods of burnout she experienced as a result of all these things that she was doing. She's the first person I've actually ever observed that went through a period of mutism as a result of her autistic burnout. And so again, I think that using high and low functioning can be very almost stigmatizing because you're not actually reflecting the real needs of the individuals. I think instead considering what their needs are and using the labels to help support those needs is a much better way to talk about autism.
I agree. And in a different example, sometimes people who are presumed to be low functioning, often because they don't speak, are actually very intelligent and capable. And so that label is completely inappropriate for them too. They may have high support needs with respect to communication, but their ability to contribute is just as great as anyone. So I think we definitely need to rethink the way we use those labels and be respectful of what people are capable of and the supports that they need as well.
Okay, so I think on that note, we're going to try to wrap things up here. Again, unfortunately, we apologize if we didn't get to any of your questions, but we really do thank you for attending and for posing such interesting questions. We will be sending out a link to the recording in coming days, and we'll also do our best to connect with anyone who we weren't able to address their questions. I will just finish this up saying, if you've enjoyed today's event, please join us again on January 24th for our next inspiring conversation, which is on perceptions and polarization, how social media shapes our opinions. Thank you again. We really appreciate you attending.
Thanks, everyone, and good luck.
Thank you.